That burning in your feet at night? Over 20 million Americans feel it right now. Doctors call it neuropathy. Most of them hand you a prescription and send you home. But here's what they don't tell you. That burning is your nerves sending a distress signal. And if you ignore it long enough, those nerves go silent, permanently. Back in the 1980s, peripheral neuropathy was mostly something doctors saw in alcoholics and a handful of diabetic patients. It was unusual. Now, 1 in 10 Americans over 60 has it. 1 in 3 diabetics develops it. Those numbers don't happen by accident. Something changed. And it wasn't our genes. What changed was our food and our medicine cabinet. The American diet shifted hard toward processed carbohydrates and liquid sugar. At the same time, more people over 60 started taking multiple daily medications for blood pressure, diabetes, acid reflux, fluid retention. And some of those medications quietly rob your body of the exact nutrients your nerves depend on to survive. So what is a nerve exactly? And why is it so easy to damage? Think of a nerve fiber like an electrical wire. It has a core that carries the signal and a protective coating called myelin. That sheath is made mostly of fat. It insulates the signal, speeds it up, keeps the nerve alive. That fatty coating depends on tiny blood vessels, thinner than a human hair, to deliver oxygen and fuel. Those microscopic vessels are the first thing to get damaged when blood sugar stays elevated. And once they're damaged, the nerve starts to starve. Not die immediately, starve slowly. That's actually good news, because a starving nerve can be fed. A dead one cannot. That's what this video is about. Have you ever left a cast iron pan out overnight with water in it? By morning, there's rust forming on the edges. Now imagine something similar happening inside your blood vessels, except instead of water, it's sugar. And instead of rust, it's something called AGEs. Advanced Glycation End-products. That's the medical term. I call it sugar rust. Here's how it works. When blood sugar stays elevated, even slightly, not just in full-blown diabetes, sugar molecules start binding to proteins. They glue themselves on, and they don't let go. This process is called glycation. Over time, these sticky deposits build up inside the walls of your smallest blood vessels, the ones feeding your nerves. Those tiny vessels get stiff, they get narrow, blood flow slows down. The nerve fiber starts receiving less oxygen, less energy. First you get tingling, then burning, then numbness. And if nothing changes, eventually, silence. Now here's what most people don't realize. You don't have to be diabetic for this to happen. Prediabetes, insulin resistance, or even years of high-carb eating can drive enough glycation to damage your nerve supply. Studies show that up to 50% of neuropathy patients have blood sugar problems they didn't even know about. So the first question worth asking yourself, when did you last check your fasting blood sugar and your A1C? Because if those numbers are creeping up, your nerves are probably already feeling it. Sugar rust damages the delivery system, but there's a second problem happening at the same time, inside the nerve cell itself. And this one is almost never talked about. Your nerve cells need vitamin B1, thiamine, to survive. Thiamine powers a critical enzyme called transketolase. That enzyme is your nerve's internal cleanup crew. It breaks down the toxic sugar byproducts that build up inside cells. Without enough B1, the cleanup stops, and the nerve cell starts breaking down from the inside out. B1 deficiency and neuropathy go hand in hand. Research has shown this connection for decades, and yet most doctors rarely check B1 levels in neuropathy patients. It's almost never on the standard blood panel, but here's where it gets even worse. Several very common medications actively deplete your B1 levels. Metformin, one of the most prescribed diabetes drugs in America, is one of them. Diuretics, the water pills millions of older Americans take for blood pressure, flush B1 out through the urine. Even certain acid reflux medications can interfere with B vitamin absorption over time. Think about that. You're taking a medication to manage one condition, and it's quietly draining the nutrient your nerves need most. Nobody connects those dots for you. Nobody sends you a letter saying your medication might be affecting your nerve health. That's why I want you to ask your doctor specifically about checking your thiamine levels. Not a general B vitamin panel, thiamine, because that one number could explain a lot of what you've been feeling. So at this point, a lot of people think, okay, I'll just go pick up a B1 supplement, problem solved. I completely understand that instinct. But here's where most people hit a wall they don't even know they've hit. The B1 in almost every standard supplement on the shelf at Walgreens, at CVS, at Costco, is called thiamine hydrochloride. It's water-soluble. And water-soluble sounds fine, right? Your body absorbs it, uses what it needs, flushes the rest. Except there's a problem. Remember that fatty myelin sheath, the protective coating around your nerve fibers? That coating is made of fat. A water-soluble vitamin can't easily cross a fat-based barrier. It's like trying to mix oil and water in a glass. They don't combine. So you swallow your B1 tablet, it gets absorbed into your bloodstream, and then it bounces off the myelin sheath instead of penetrating it. The nutrient never reaches the nerve tissue where it's actually needed. You've spent $15 on supplements your nerves can barely use. This isn't a fringe theory. There are peer-reviewed studies published in the International Journal of Clinical Practice showing this. Standard thiamine supplementation produces measurably lower nerve tissue concentrations compared to fat-soluble alternatives. The research is there. It's just not making it onto the label of the bottle at your local pharmacy. So what's the alternative? We'll get there. But first, there's another supplement mistake I need to warn you about. This one doesn't just fail to help. It can actually make things significantly worse. Vitamin B6, pyridoxine. You've probably seen it in every multivitamin you've ever taken. It's marketed as essential for nerve health, brain function, energy. And in the right amounts, it is. B6 genuinely plays a role in nerve signaling and neurotransmitter production. But here's what nobody puts on the front of the bottle. Too much synthetic B6 is neurotoxic. It damages nerves, the very thing it's supposed to protect. This is called pyridoxine-induced neuropathy, and it's more common than most people realize. The symptoms? Tingling and numbness in the hands and feet. Sound familiar? People take high-dose B6 for months, trying to treat neuropathy, and actually making it significantly worse, without any idea their supplement was the cause. The safe upper limit set by the National Institutes of Health is 100 milligrams per day for adults. But B6 is added to dozens of supplements and fortified foods. A multivitamin here, a B complex there, a breakfast cereal. It adds up fast. And if you're also taking a standalone high-dose B6 supplement on top of that, you could easily cross into dangerous territory. The form matters too. Pyridoxine hydrochloride, the synthetic form in most cheap supplements, is the one most associated with toxicity at high doses. Pyridoxal 5-phosphate, P5P, is the active form your body uses, considered significantly safer at the same doses. So here's my practical advice. Go look at every supplement you're currently taking. Add up your total daily B6 across all of them. If you're over 100 milligrams, and especially if you're taking a standalone high-dose B6, talk to your doctor before continuing. Because more is absolutely not better here. This is one of the most important things I'll say today. So if standard B1 can't cross the myelin barrier, what can? The answer is benfotiamine. It's a fat-soluble form of vitamin B1. Same vitamin, completely different behavior inside your body. Because it's fat-soluble, it passes right through that fatty myelin coating. It gets inside the nerve cell. It reaches the tissue where the damage is actually happening. And the research on this is genuinely impressive. Multiple clinical trials, including studies specifically on diabetic neuropathy patients, show benfotiamine significantly reduces nerve pain and improves sensation. One study, published in Diabetes Care, found patients taking benfotiamine showed measurable improvement in nerve function scores after just 3 weeks. Not 3 years, 3 weeks. The typical therapeutic dose used in research, 300 milligrams per day. Not 50 milligrams, not the trace amount in a multivitamin. 300 milligrams of benfotiamine specifically. You will not find this at most chain pharmacies. You need to look for it by name, benfotiamine, at a health food store or a reputable online supplement retailer. Yes, it costs a little more, but you're not paying for something that bounces off your nerve cells. You're paying for something that actually gets inside them. Has anyone here already tried benfotiamine? Drop it in the comments. I'd genuinely like to know your experience. Benfotiamine is the foundation, but it works best as part of a team. There are 3 other key nutrients. The first is alpha-lipoic acid, ALA, one of the most powerful antioxidants your body produces. It works in both fat and water environments, which makes it uniquely effective for nerve tissue. ALA helps neutralize the oxidative damage caused by glycation, and it has a documented ability to improve nerve conduction velocity, meaning it helps electrical signals travel faster along damaged fibers. But not all ALA is the same. Look specifically for R-lipoic acid, stabilized RALA. The standard version is a 50-50 mix, The S form is inactive. It does nothing. You want the R form. 300 milligrams per day is the dose the research supports. The second partner is methylcobalamin. That's the active form of vitamin B12, the primary builder of myelin. Without adequate B12, your body literally cannot repair the nerve coating. And B12 deficiency is extremely common in people over 60. Partly because stomach acid production declines with age, making B12 harder to absorb from food. The methylcobalamin form bypasses most of those issues. The third is acetyl L-carnitine, ALCAR. Think of it as the fuel delivery truck for your nerve cells. ALCAR transports fatty acids directly into the mitochondria inside nerve cells, where they're converted into energy. Nerves starved of energy cannot repair themselves. Studies using 500 milligrams of ALCAR daily showed reductions in neuropathic pain and improvements in nerve fiber density, meaning nerves actually growing back. The science is real. 4 nutrients: benfotiamine, RALA, methylcobalamin, ALCAR. Not a magic pill, a targeted strategy based on what research actually shows. Here's the thing about supplements. They work a lot better when you stop actively fueling the problem. And for neuropathy, 2 specific dietary culprits are like throwing gasoline on a fire. The first is refined carbohydrates and liquid sugar. White bread, white rice, pastries, sweetened drinks, fruit juice. All of these spike blood glucose rapidly. And every spike drives another round of glycation, more sugar rust on your nerve vessels. You don't have to go zero carb, but pulling out the worst offenders makes a real difference. Swap the white bread for whole grain. Replace the soda and juice with water. Those 2 changes alone reduce your daily glycation load. The second culprit is industrial seed oils. Soybean oil, canola oil, corn oil, sunflower oil, in almost every processed food in America. They're extremely high in omega-6 fatty acids, which promote inflammatory pathways. And chronic inflammation is a key driver of nerve damage. Replace them with olive oil and real butter. Not a radical overhaul, just swapping what you cook with. And now, the simplest, most underrated tool in this entire video. A 10-minute walk after your biggest meal of the day. Research published in Diabetes Care showed a short walk after eating reduces post-meal blood glucose spikes by up to 22%. Your muscles absorb glucose during movement, pulling it out of the bloodstream before it can start glycating your vessel walls. 10 minutes after dinner, every night. No gym required, no special equipment. Just walk around the block. Are you already doing this? Let me know in the comments. I'm always curious how many people have discovered this on their own. Let's say you take everything seriously. You start benfotiamine, RALA, methylcobalamin, ALCAR. You make the dietary changes. You walk after dinner. You're doing everything right. And then, 2 weeks in, the burning gets worse. The tingling intensifies. Maybe the pain kicks up a notch. Your first instinct is to stop everything and think, this isn't working. Don't stop. What you're likely experiencing has a name. Doctors call it the awakening phenomenon. And it is actually a sign that something is going right. Here's what's happening inside your nerves. For months, maybe years, your nerve fibers have been so damaged and starved that they've essentially gone quiet, numb, silent. When you start feeding them properly, when blood flow improves and repair nutrients finally reach the tissue, those fibers start waking up. An awaking nerve is a noisy nerve. It fires, it tingles, it burns, not because it's worse, because it's coming back online. Think about your foot falling asleep. When circulation returns, that rush of pins and needles, that's not damage, that's recovery. Not every increase in symptoms is the awakening phenomenon. Some pain does signal a problem getting worse. That's exactly why you cannot do this without your doctor's knowledge. Keep them informed, every step of the way. But if you've started a targeted protocol and symptoms temporarily flare in the first 2 to 4 weeks, stay the course. For many patients, that uncomfortable phase is the last one before things genuinely start to improve. The nerves that recover are the ones that get the chance to wake up. Let's bring it all together. I want you to walk away with 5 things from today. First, neuropathy is not just aging. It is a starving nerve, and a starving nerve can be fed back to health. Second, glycation, sugar rust, is quietly destroying the tiny vessels that keep your nerves alive. Your blood sugar is a nerve health number. Get it checked. Your fasting glucose and your A1C. Those numbers tell you how much damage may be happening right now. Third, your medications may be reducing the nutrients your nerves need most. Metformin, diuretics, acid reflux drugs. If you take any of these, have a specific conversation with your doctor about thiamine and B12 levels. Not general, specific. Fourth, the supplements most people reach for aren't built to reach nerve tissue. Benfotiamine, R-ala, methylcobalamin, Alcar, those are the ones research supports. Dosing matters. Form matters. Generic is not good enough here. Fifth, 2 dietary changes and 1 daily habit can meaningfully slow the damage. Cut the liquid sugar. Swap the seed oils. Walk after dinner. Before you close this video, write down one thing from today you're going to act on. Just one. Maybe it's scheduling a blood sugar check. Maybe it's looking up benfotiamine. Maybe it's taking a walk tonight after dinner. Because one change made consistently beats 10 changes abandoned after a week. I have a question for you in the comments. Have you or someone you love been dealing with neuropathy? And what has actually helped? I read every single comment on this channel. Your experience might be exactly what someone else needs to hear today. Everything I've shared today is general education only. Your situation is unique. Before changing anything, please talk to your own doctor first.